My name is Jeff Wuso. I am MetaStar's Business Development Manager, and I'd like to provide you with a quick overview of MetaStar, as well as introduce you to your primary presenter tonight. MetaStar is a nonprofit quality improvement organization that's been in business for over 45 years. MetaStar is a mission-driven organization working in many areas of healthcare, and we've been providing HIPAA privacy and security services, including security risk assessments, for 10 years. Brad Trudell is MetaStar's HIPAA Privacy and Security Lead in Corporate Counsel. He's held this position since 2014. Brad's an attorney with over 20 years of experience focusing on HIPAA privacy and security. And prior to joining MetaStar, he was the privacy officer for a large health insurance company in Wisconsin. Since joining, Brad has conducted hundreds of HIPAA security risk assessments in over 45 states. These have been for optometrists, ophthalmologists, surgery centers, clinics, hospitals, health systems, as well as various government entities. And all of MetaStar's security risk assessment customers work directly with Brad, and we'd welcome the opportunity to work with your organization. So our primary goal today is to provide you with an overview of HIPAA security risk assessment requirements, how a risk assessment works, and best practices for your organization. I will now turn the presentation over to Brad.
All right, thank you, Jeff, for that introduction. And thanks also to all of our attendees, there we go, for the opportunity to discuss security risk assessments with your practices today. I thought I would start out the presentation with a bit of HIPAA 101. What is HIPAA? What does it stand for? Why do we even care about it? HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. This was a federal law passed by Congress and signed into law by then-President Bill Clinton. And the main goal of the original HIPAA legislation dealt with portability of health coverage. That is, when an employee went from employer A to employer B, being sure that they were able to maintain healthcare coverage when they went to their new employer. So this involved rules regarding special enrollment rights, pre-existing conditions, creditable coverage, late enrollment, basically when you could and could not exclude someone with pre-existing conditions from coverage. Also tucked into that original HIPAA law was a section called Administrative Simplification. And this portion addressed the standardizing of electronic transmissions of health information. So before HIPAA, plans and providers largely used their own proprietary transactions and code sets to communicate electronically with each other. It was very cumbersome, burdensome, and expensive. All the plans and providers had to keep track of all the transactions and code sets that other plans and providers were using if they wanted to be able to communicate electronically. Well, HIPAA's goal was to change all that through administrative simplification by standardizing the claims processing through the use of these standard transactions and code sets. But at the 11th hour, they realized that there may be some privacy and security concerns with all of this health information being sent around internal and external networks electronically. So what they did is they tucked into the HIPAA law a requirement for Congress to, down the road, come up with an additional law regarding the privacy and security of health information. There was a deadline in there for Congress to act. It failed to do so. So once again, Congress failed to meet its own self-imposed deadline. Therefore, it got kicked over to the Federal Department of Health and Human Services to come up with privacy and security regulations. So here's an overview of the timeline of HIPAA and HITECH. 1996, as I said, the original HIPAA law was passed by Congress. HHS, the Department of Health and Human Services, did get around to finally coming up with their final privacy rule. It took them about 7 years to do so. So that went into effect in 2003. And then it took them a couple more years to come around to implementing the final security rule. Now, the privacy rule and the security rule do overlap somewhat, and we'll talk about that a little bit later. But largely, they both deal with PHI and protecting patient data. So after the security rule went into effect, not a whole lot changed in HIPAA world over the next few years until 2009. And this is when, you may recall, then President Obama first came into office. One of the first pieces of legislation that he signed was what later on became known as the Obama stimulus bill. The stimulus bill was a gigantic $1 trillion bill, the main goal of which was to jumpstart the economy after the deep recession we had gone through. But part of that large $1 trillion bill were several other smaller bills, and one of those was called the HITECH Act. And the HITECH Act, for the first time, made some serious changes to the HIPAA privacy and security rules. Then, as usually happens, a few years later, 2013, the federal regulators got around to coming up with final HITECH regulations. And these regulations made some serious additional changes to privacy and security. For example, for the first time ever, business associates were required to comply with all of the HIPAA security rule. We'll talk about what business associates are a little bit later. And then also, for the first time at the national level, all breaches of PHI, patient data, would require a notification be sent to the individual who was affected. So again, some serious, significant changes to HIPAA as a result of the 2009 and 2013 HITECH law and regulation. So the main goal of the HIPAA security rule is to ensure what we call the CIA of ePHI, ensure the confidentiality, integrity, and availability of all electronic protected health information. And that's an important point. The HIPAA security rule only applies to electronic patient data. The HIPAA privacy rule, on the other hand, does apply to all patient data, regardless of form or format. Could be electronic, hard copy, even conversational. But the security rule, which is our focus today, only applies to electronic PHI. So what do we mean by confidentiality? That really is just another word for privacy. So of course the privacy rule is concerned with maintaining the privacy of PHI, but the security rule is as well. And by integrity, we're talking about ensuring the accuracy of the data, making sure that it has not been tampered with. For example, if PHI is electronically transmitted from point A to point B, making sure that when it arrives at point B, it's in exactly the same format as it was when it left point A. And finally, we have availability. And really this is ensuring that the data, the PHI, is there when it's needed to be used for providing healthcare treatments and services. Next, I thought I'd look at the key sections, the main provisions of the HIPAA security rule. And really the guts of the rule are the first three sections of safeguards: administrative, technical, and physical. Under administrative safeguards, we have the requirement to periodically conduct a security risk assessment, or SRA, which of course is the topic of today's conversation. Also within the administrative safeguards of the HIPAA security rule is providing staff members with security training. This is a requirement of both the privacy and security rules. You're required to have policies and procedures in place and then train your staff on those policies. Also having contingency plans in place for emergencies, for disasters. This is an administrative safeguard that's required by HIPAA. Next up, we have the technical safeguards. Here what we're really talking about is controlling access to electronic PHI that's on your system, on your EHR or some other electronic system. Also encrypting data. We'll talk later, there are two types of data, two types of PHI. There's data at rest that's sitting on a machine somewhere, and then we have data in transit that's moving over a network. Well, HIPAA requires both types of PHI to be encrypted, and we'll talk a little bit more about what that involves later on. Also, using audit controls, having audit controls in place. This is a technical requirement under HIPAA. And the reason for that is if you suspect a breach or a security incident and you want to sort of go back in time a little bit, do your investigation, see who accessed what data, when, did they have a legitimate reason for doing so. In order to do all that, you need to have audit controls in place. Then finally, under the safeguards, we have the physical safeguards. And what we're talking about here is controlling physical access to the facilities where you store your patient data. In addition to that, policies are required on disposal and reuse of devices that contain patient data. If you're going to be reusing a device, for example, a laptop's going from employee A to employee B, you want to make sure that all of the patient data is completely wiped off that machine before it goes to the new employee. Then we have a section called organizational requirements under the security rule, and really this mainly is concerned with business associates and business associate agreements. Business associates are vendors who they more or less handle PHI on your behalf in order to perform a function or service for you. And if you are going to have a vendor handling PHI on your behalf, then of course you have to have a business associate agreement in place whereby they promise to comply with HIPAA. Then the last section of the security rule is policies and procedures and documentation requirements. This part simply says that each covered entity must put together reasonable and appropriate written policies and procedures to comply with the various parts and pieces of the security rule. So the HITECH Act, I've mentioned that a couple of times. As I said, it expanded the privacy and security requirements to business associates for the first time. Some of the privacy rules requirements now apply to business associates. Most still do not. But as I said earlier, 100% of the security rules requirements now apply directly to business associates for the first time. Also contained within the stimulus bill was a requirement under Section 13411, a requirement for the Department of Health and Human Services to conduct regular audits of covered entities, health plans, healthcare providers, and business associates to check to see how well they are doing in complying with the primary HIPAA regulations, privacy, security, and breach notification. It should be pointed out that before this section of the stimulus bill went into effect, HIPAA investigations were largely complaint-driven. They were very rare, and the main reason given for that was that HHS just didn't have the funding to go out there and do these audits. They're very time-consuming and costly. And as we'll see, the HITECH Act also beefed up the penalties for potential HIPAA violations. So now there's more money flowing back to HHS because of violations. They are using that to fund further audits, and it's really becoming a vicious cycle. Another major change under the HITECH Act, it really beefed up the potential penalties for HIPAA violations. What it did is it created a 4-tier penalty scheme for those HIPAA violations, and this same scheme applies to any HIPAA violation, whether it's the privacy rule, security rule, or breach notification. So basically at the lowest level, we have did not know, and reasonably the person couldn't or shouldn't have known that what they were doing was going to result in a HIPAA violation, but it happened, and technically it was a violation. Generally, if something of this nature happens, the organization will get a slap on the wrist and not a whole lot more. A step up from did not know is called reasonable cause. And at this level, this is where the covered entity or the business associate knew or should have known that what they were doing would result in a violation of HIPAA, but they still went ahead and did it, and yet they did not act with willful neglect. They didn't have any bad intent. They kind of took a shortcut. They should have known better, but no harm, no foul. No major penalties are likely to result from something like that. Then finally, we come to the worst case scenario, willful neglect. And willful neglect really, this is a violation that was the result of conscious, intentional failure, reckless indifference regarding the obligations to comply with HIPAA. This is where the organization not only knew what they were doing was wrong and would likely result in a HIPAA violation, but they also had some sort of bad intent that went along with that. And even in this worst case scenario, the feds will give you 30 days to correct that bad behavior. If they come back a month later and it still has not been corrected, that's when they'll really throw the book at you with everything they have. And as far as what they can do to you, penalties can now range from $100 up to $50,000 for each violation. This is another area that HITECH really bumped it up. This used to be $100 max for each violation. Now it's up to $50,000. And also, cumulatively, they can penalize you up to $1.5 million per year for these violations. And pre-HITECH, that was only up to $25,000. So $25,000 to $1.5 million. That's a gigantic leap in the potential penalties that a business associate or a covered entity can face due to HIPAA violations. Still important to point out that there is no individual cause of action under HIPAA. So if one of us, as an individual who has our own PHI, if one of us feels that an organization has violated our HIPAA rights, we still cannot sue them in court. We have to go to the authorities and have them file some sort of action. But an important change under HITECH, the 50 state attorneys general now have the ability to bring actions for violations of HIPAA. And this is quite unusual. It's very rare for the federal government to give states the right to enforce a federal law, but that's exactly what has happened under HITECH Act. So now instead of just one regulatory oversight body, HHS, being able to go after folks for HIPAA violations, there are 51 organizations that can do so. And some states have been more aggressive in that respect than others. New York and Connecticut, for example, have been at the forefront. Looking at OCR investigations and audits that have occurred, the feds finally got around to rolling out the very first phase of formal HIPAA audits back in 2011, 2012. So what HHS did was they selected one of the big 5 accounting firms, KPMG, so this is a private company, and they had them conduct the audits. So KPMG randomly selected 115 covered entities, so healthcare plans and healthcare providers. And for each of the 115, they conducted comprehensive on-site visits. As part of this process, they also developed what they called the OCR HIPAA Audit Protocol tool. And what the audit protocol tool is the detailed questions and other information that they're asking when they come on site to do a formal HIPAA audit. So as you can imagine, that's a very detailed document, but it's posted on the HHS OCR website. And OCR simply stands for the Office of Civil Rights. That's part of HHS. It's sort of the muscle, the enforcement part of the agency. And so I do recommend that you go out there and look through that audit protocol. If you can look through the questions and answer most, if not all of them, in the affirmative, then chances are you would fly through a real HIPAA audit with flying colors. So then a year or two after the first phase of audits was concluded, 2013, OCR did release a formal evaluation of this first phase of the program. And they did determine that most of the entities that they audited did have areas of non-compliance with HIPAA. That's not a surprise. And the most common reason given for the non-compliance was that the organization was simply unaware of the requirements. They weren't aware of the HIPAA requirements, and so they failed to comply with them. Also important to point out that most of the organizations audited failed to perform a security risk assessment. Of course, that's very important. It's the baseline that you need to conduct in order to figure out which areas of HIPAA you comply with, which ones you don't, and it really forms the basis for your action plan later on. Most organizations had never done one. So then a few years later, July of 2016, OCR started up phase 2 of the HIPAA audit program. This time they did things a little bit differently. Instead of hiring an outside firm, they did the audits themselves. Instead of comprehensive on-site visits, they did desk audits. And this is where they basically randomly selected organizations. This time there were 166 covered entities, most of them being healthcare providers. And they sent them comprehensive document request forms. They requested all kinds of documentation, HIPAA, privacy, policies and procedures, security risk assessments, action plans, etc. And then once all that documentation was submitted to OCR, they would go through and follow up with additional questions. This really saved a lot of money versus the comprehensive on-site visits that were done in phase 1. Also, this time around, they selected 41 business associates to take part in the audits. This is a big difference from the first time where only covered entities were included. And then once again, the HIPAA OCR audit protocol, they updated the tool for phase 2, and the updated tool is still on their website as of today. It has not been updated since April of 2016. And the result of this phase of the audits was that 94% of covered entities had inadequate SRA, security risk assessment or analysis plans, and they also failed to have adequate risk management plans in place to address the risks identified through the SRA process. So what we're seeing through both phase 1 and phase 2 is basically lots of incompetence, gross incompetence when it comes to complying with the HIPAA security rule. So what's the lesson here for eye doctors? As Jeff said earlier, we've done lots and lots of security risk assessments with eye doctors, and the biggest finding that we find is that in the past they have failed to conduct a HIPAA security risk assessment. Again, that's that baseline. You don't know where to focus your compliance efforts if you don't know where your gaps in compliance with the requirements are. Also, a lot of times eye doctors will fail to have adequate written policies and procedures in place to comply with the HIPAA security rule. Again, the HIPAA security rule has 80 to 85 parts and pieces to it that you need to comply with, and you need to have a policy in place, a written policy that reflects each one of those requirements. Also, PHI on mobile devices, very common issue. A single mobile device can have multiple types of PHI on there. They can have PHI that's at rest, sitting on the device. And if you're sending and receiving emails, for example, then you could also have ePHI in transit. Well, both forms of data need to be encrypted. And with those mobile devices, you also want to be able to have remote wiping activated. Contingency planning, disaster recovery planning. Having a DRP, a disaster recovery plan, is essential. You basically need to sit down and figure out, for your organization, what are your top threats to your PHI, to your patient data, and then go through and map out, at least at a high level, how you would react to those situations should they actually occur in the real world. So very important to have that documentation in place, which of course includes backing up your electronic data. So the security risk assessment process, as I said, it's geared towards protecting the CIA of your ePHI, the confidentiality, integrity, and availability of that data. And what it does is it goes through all of the HIPAA security rules safeguard requirements. Those are the administrative, physical, and technical safeguards. It goes through them one by one with a fine-tooth comb, and it tries to figure out which ones you are in compliance with as of today. This is a snapshot in time, and which ones you still need to work on. And the process looks at your risks and vulnerabilities, and that's the process it uses to come up with your final list of risks. And that risk list, we want that to be prioritized. All risks are not created equal, and we want to give you an understanding of where the higher rated risks are, some of the things you should start tackling first, and hopefully with relatively low expenditures of staff time and other resources. That is the goal. So some folks ask us, can we do an SRA ourselves? And the short answer is yes. Nothing prohibits you from doing an SRA in-house by yourself, and a few folks do just that. We've seen practices create their own Excel spreadsheets or Word document tools that they use to track their compliance with the HIPAA security rules requirements. But of course, this method would require a fairly robust level of technical knowledge regarding the use and disclosure, storage, and transmission of electronic data. I should also point out that the federal government has put together a free tool that can be used to conduct an SRA. This was put out by the ONC, the Office of the National Coordinator for HIT, and ONC developed this free tool and made it available for download from their website. And they have improved the tool over the last few years. They really have in some ways, but it should be noted that the ONC tool is still missing some significant pieces. For example, it does not come with any type of support staff to answer any of your questions. It provides no sample policies or procedures, and it does not contain a very good action plan with advice on how to mitigate or fix the risks identified in the final report from your SRA. So because of these shortcomings, most organizations end up choosing to use a third-party vendor, such as MetaStar, to help them conduct an expert-assisted assessment of their potential security risks. And of course, this expert approach can have several benefits. Having that support staff on hand, for example, to answer any questions as they arise. Having access to sample templates, policies, procedures, other documents. That certainly makes drafting your own policies much easier later on. Secure cloud storage of your security risk assessment responses and your supporting documents, as well as production of a detailed final report containing that prioritized listing of your risks. And included with that should be advice on how to mitigate, how to fix each of the identified risks. And then finally, we have that interactive action plan, or the risk remediation plan, risk mitigation plan, lots of names that it goes by. Really, it's the plan that helps you map out and tackle those risks identified in the SRA final report. So what we're looking at here on the screen right now, this is a screenshot from the tool that we use, the web-based tool, a very robust tool. We think it's the best one out there. And what a good tool should do is it takes those 85 or 90 requirements of the security rule, breaks them down, and then reorganizes them in a way that makes a lot more sense for the modern healthcare industry. For example, you'd have a section HR Director, EHR Administrator, IT Network Manager, IT Server Manager, HIPAA Security Officer. There will also be a few questions that more pertain to a facilities type person, a facilities manager. And then within each section, you may have a variety of questions that you would have to answer, upload certain documentation. But again, this makes a lot more sense in the healthcare industry today instead of just looking at the HIPAA security rule as written and then trying to slog through it. Another screenshot from our favored tool. The questions should be written in a way, as I said, that does not simply regurgitate the regulatory language. It should be written in a way that's easier to understand. And most of the questions, this is just simply the way HIPAA is written, most of the questions will ask two things. One, are you doing something that HIPAA requires you to do? And two, do you have a written policy in place that shows you're doing what HIPAA requires you to do? And that's exactly the format of this sample question. It's asking if you have a written policy about applying worker sanctions against employees who might violate HIPAA. So it's asking two things. Do you have a sanction policy? And they're going to also want to see proof that you're applying it against employees when necessary. So with a tool like this, if you answer the question yes, you're basically saying we do have this written policy and process in place, and therefore the tool is going to force you to upload that policy that you are telling it you have in place before allowing you to move on to the next question. And that part of the process is critical. It's going to force you to upload, attach the proof, the supporting documentation, because that will be essential if you ever get selected down the road for a formal HIPAA audit. They will demand to see all of that documentation to prove your assertions. Then at the end of the process, the final report, it should use what we call the NIST SP 800-30 methodology. That's just a fancy name for a way that you can conduct your SRA, and it's become the gold standard in the healthcare industry. Our tool that we use, our web-based tool for conducting HIPAA SRAs, uses that method, the 800-30, and it uses that method to come up with a listing of your risks, and you can see that is on the far right column. The risk rating for these particular risks is all high. If we were to scroll down further in this report, we would see highs, mediums, and lows. So again, the whole goal is to come up with those risks, but to prioritize them for you so you have a better understanding of which ones you should tackle first, which ones are the biggest threats to your patient data. At the end of the process, a lot of the things you'll have to do will have to do with drafting or revising, updating security policies and procedures. That probably is the biggest glaring omission that we find when we do these assessments. The biggest gap we see is lack of adequate written policies. As part of that, you may need to tweak your processes, your workflows as well as work on your employee training. I mentioned security training earlier. It's a requirement of the HIPAA rules. And if you do go through and do an SRA and you end up tweaking a bunch of your policies, of course you will need to train your staff on those new revised, updated policies as well. And then updating software is also a common outcome from the security risk assessment process, whether it's operating systems, antivirus, encryption software. A lot of times these things are not quite up to snuff, and they need to be updated as well once the security risk assessment results come in. So I've talked about that action plan, and the security risk assessment process really does have the two parts. Part one, on the front end, you're going in, you're answering the questions, uploading your proof, your supporting documentation. Once that part of the process is done, you get your final report containing your prioritized listing of risks, representing your gaps in compliance with HIPAA. At that point in time, part two of the process starts, and this is the action plan. The question there is, now that you have your SRA final report containing your risks, what are you going to do about them? And of course, the answer is you need to work on them. So that's where the action plan or action history comes in. Any good web-based SRA tool is going to have an interactive action plan built in. And it should be populated with all of the risks from your SRA final report. And it should also give you a place to track the progress made on those risks over time. So you can see in this screenshot, there's room to enter who did what and when for that particular risk. And also there's a choose file button. You can upload your supporting documentation. For example, maybe you were missing that sanction policy. You never had a written sanction policy in place. Then after the SRA, a couple weeks, couple months down the road, you find time to write and implement a sanction policy. You can come out here and explain that you did just that. Click choose file and upload that supporting documentation. So very important to have that interactive action plan part. If you do get selected down the road for a federal HIPAA audit, the two things that they will ask for first, show us a copy of your most recent SRA and show us a copy of your action plan that proves you've been working on the items identified in your SRA. All right, so I thought I would finish the presentation today by going through 5 steps that organizations can take right now, that eye doctors can take right now to ensure that they're going to fly through a HIPAA audit with flying colors. Of course, the first thing to do, we've mentioned it several times, conduct that thorough security risk assessment. It's required by the security rule. It's also required by promoting interoperability, formerly meaningful use, QPP. All of these programs require that if you're going to attest for a given year, you must conduct or review an SRA during that year. Unfortunately, they've never given any good guidance about what it means to review an SRA. So our strong recommendation is that if you're attesting to any of those programs, you need to conduct an SRA during that attestation year. The SRA process, it assesses the potential threats to the CIA of your EPHI. The whole idea is to go through all of those safeguards one by one and determine which ones you are currently in compliance with, which ones you're not. It's important to note that an SRA is really just a snapshot in time. As of the day that you're conducting the SRA, what do you have in place? Some folks feel the need to cobble together some policies or other documents on the fly as they're doing the SRA because they think too many no responses are piling up. That's not important at all. There's no pass-fail rate, nothing like that at all. The whole idea is to go through and answer the questions as accurately and honestly as possible. You're only hurting yourself down the road if you answer yes to things that you're not really in compliance with. So it truly represents a snapshot in time. And I've mentioned the 800-30. That's the most commonly used methodology for conducting a HIPAA-style SRA. It was put out by NIST, and it's been out since 2002, but it's the gold standard. There's nothing better in use today. The action plan, sort of part 2 of the SRA process, those HIPAA auditors are going to want to see a copy of your SRA, but also they want to see proof that you're working on the risks identified in that final report. We call that the risk mitigation plan. And we're really talking about a classic action plan here. So it should be populated with all of your risks, but each of those risks should have a person's name and a target date associated with it. And the reason for that, the name doesn't necessarily have to be the worker bee who is actually fixing that particular item, but the name should be at least somebody that has general oversight to make sure that that item eventually gets mitigated. And then the target dates, we don't want things just hanging out there indefinitely. A HIPAA auditor is going to want to see that you are working towards fixing these things, that you have specific target dates in place by which they will be fixed. That does not mean the target dates have to be set in stone. If you start bumping up against them, you can move them out a little further, but the lesson here is that you need to have at least a target date initially by which you expect to have that risk mitigated. The action plan really should include this log of progress. It should be populated with all of your risks, but as you work on them one by one, it should be able to show you who did what and when, what exactly did they do, and it should also allow you to upload any supporting documentation that you wish. We mentioned that a lot of times the outcome of an SRA is updating policies, processes, workflows, software. And at the end of the day, very, very important, critical from an auditing standpoint, that you are training folks on whatever changes you've made as a result of the SRA and action plan. Documenting security policies and procedures. When we go through and conduct SRAs of eye doctors, this is the biggest thing that we see missing, adequate policies and procedures. And when we're talking policies and procedures, they must be written. They must be written, they must be implemented, they must be periodically reviewed. And at the top of the list should be your security risk assessment and action plan or risk mitigation plan policies. You need a written policy in place that says we do SRAs, we do them annually or however frequently you choose to do it. It should also explain what methodology is used and who in the organization is responsible for conducting the SRA and then working on the risks identified. That all needs to be documented in written policy. Information security policies, who has system access, things like that. Managing security incidents and breaches, those are related concepts. Some folks use those terms interchangeably. They're actually different, but for our purposes, you need to have written policies in place that explain what is a breach, what is a potential security incident. If I come across one, to whom should I report it? Who will be responsible for investigating it? And then what will happen to the outcome of that investigation? All of this needs to be documented in a written policy. Business continuity, disaster recovery, emergency mode, operations planning, lots of different terms for the same overall concept, which is what would happen if your practice suffered a disaster or an emergency, something that threatened your patient data. You need to have written plans, at least at a relatively high level, that explain what the organization would do in the event of such a disaster or emergency. Of course, that includes backing up your data. For those folks who use a cloud-based EHR, that backing up is done largely automatically. So that's a very nice feature of a cloud-based EHR. Also, you need to have written policies about destroying PHI. If you no longer need it, you should not keep it around because it could result in an unnecessary breach. But you need to have a written policy that explains how you're going to decide when PHI can be destroyed and what method or methods you're going to use to do so. Encryption of data, very, very important under HIPAA. Those two types of data, data at rest, sitting on a machine, or data in transit that's flowing over an open network, such as the internet. Both types need to be encrypted to protect patient identification, and you need to have written policies in place that show exactly what types of methods you're going to use to encrypt that data. Internal auditing controls, very, very important to have a written policy that explains what those controls are, who decides what controls to put in place, and maybe down the road they need to be changed, what's the process for reviewing new controls and implementing them. But again, the whole key with having audit controls in place is to be able to go back and investigate a breach or a security incident to see if there was inappropriate access to PHI. Physical security, here we're talking about a written policy that explains things such as, do employees have to wear ID badges? What's your visitor policy? Does a visitor need to sign in and be given a visitor badge and then escorted around the premises? All these things should be laid out in your written physical security policy. Training, I've hammered on this a couple of times. I will hit it one more time. It's one thing to have in place good, solid written policies and procedures, but if you're not training your folks adequately on your own policies and procedures, then from an auditing standpoint, those policies don't even exist. You need to train folks on what they need to know to comply with them. Both the HIPAA privacy and security rules require training, both for new hires and then on a periodic basis. Important to point out that not all training has to be the same for all employees. The training only has to be regarding what's necessary and appropriate for that specific person's job duties. So the janitor does not necessarily need the exact same HIPAA training as the CEO, for example. However you do decide to do your HIPAA training, you must document it. You need to provide proof to a potential auditor that, yes, training is occurring, it's occurring on a regular basis, here's proof that it has occurred, here is proof of what the content of the training was, things like that. So however you decide to do it, make sure it's documented and you have proof. Related to but separate from technically the requirement to do security training is the requirement to do periodic reminders, periodic security reminders. The security rule does not say how those reminders need to go out. Newsletters, email, those are some common ways of sending them out. You can also do some during face-to-face staff meetings, but the key point here is that you should have proof that you are sending out periodic security reminders to your staff. And also, we like to add, as part of the training, you should incorporate showing the name of the privacy and security officers. Those are usually two separate individuals. Sometimes one person will wear both of those hats, privacy and security. But we think it's very important for folks to know the names and the faces of those privacy and security officers. If they don't know their names, it makes it much less likely that they will report potential breaches to them later on down the road. Then finally, we have documenting all of your policies, procedures, etc., organizing it, keeping it for at least 6 years. This is a HIPAA requirement of both the privacy and security rules. keeping all of your supporting documentation, your HIPAA policies, etc., for at least 6 years. What that really means is that if you get selected for a federal HIPAA audit, the auditor can look back a full 6 years and say, okay, show us 4 or 5 years ago exactly what you had in place for your HIPAA program. And you will need to produce all of the policies that were in effect at that time. You'll need to provide copies of all the different HIPAA forms that individuals sent in, requests for information, etc., authorization forms. So very important to keep all that supporting documentation for at least 6 years. In a HIPAA audit, the auditors will also ask for device listings, a couple of different types of device listings. One, they will ask for a listing of devices which contain your PHI, laptops, computers, servers, etc. They want to know where your PHI sits, where it resides, and the audit will go from there. Also, they will ask for a listing of your network devices. These types of devices, generally speaking, do not contain PHI stored on them. These are things like routers, switches, firewalls. But taken together, those devices do create the infrastructure for your network. And of course, a lot of your PHI does flow over that network. So they will want copies of both of those lists if you're selected for an audit. They will also, of course, ask for a copy of your most recent security risk assessment, along with the action plan that shows that you've been working on the items identified, the risks identified in that final report. Lots and lots of forms come along with HIPAA, especially on the privacy side, access requests, authorizations. Folks also have the right to send in written complaints regarding anything about your HIPAA compliance program. All of these types of forms that we're talking about need to be kept for at least 6 years. Also, when it comes to breaches, if an employee reports a suspected potential breach of PHI, then internally you must, of course, you have to have a written policy on breaches that explains how that's going to be handled and investigated internally. But you also need to keep a log of those breaches. If it's a small breach, under 500 individuals involved in that single breach, then you need to keep a running tally throughout the year of those breaches and submit that to the feds once a year. If it's a large breach, 500 or more individuals involved in a single PHI breach, for those you need to report those to HHS immediately via their website. So regardless of the size of the breach, eventually it will be reported to the feds, and you need to keep track of all of those, keep logs, and also, if possible, keep logs of the security incident investigations that you conducted. Also, training, again, whatever you're doing for the training, you need to document it. You need to prove to a potential auditor that you are conducting training on an annual basis. Then, of course, immediately upon hire for new hires, as soon as possible before they access PHI. But you're going to want to show dates that training was conducted, names of folks that attended, etc. All right, so if any of our participants today are looking for comprehensive yet affordable help with their security risk assessments, we certainly encourage you to contact us here at MetaStar. Our team has expert knowledge and literally years of experience regarding the risk assessment process and the requirements, and we offer personalized service whereby we become a virtual member of your team as you work on completing your security risk assessment. And with that, do we have any questions?
Brad, I don't see any questions, so thank you so much for the overview of HIPAA as well as the background and details on the risk assessments and why they're so important for practices. All right, everyone, thank you so much for joining. And if you have any other questions or need information on our services, please reach out to us. All of the information is available on www.metastar.com. Thank you.